We've got a huge and massive problem with mental health care in the province of Ontario. And not only the province of Ontario, but pretty much the whole world. When our politicians and when people in general view mental health, they see that as something totally different than somebody who broke their foot while riding a bicycle or somebody who was just diagnosed with cancer. And by the way, my heart goes out to all those people. But the thing is that people see healthcare as something, at mental healthcare and mental health issues as something totally different. And as a result, mental health care gets taken a back seat by other things. And the reason I'm talking about this issue is not only because I know a lot of people who suffer from mental health problems, but also because right here in Ontario, in the province of Ontario, Canada, which is supposed to have the best healthcare in the world, we have a woman in the London, Ontario area who waited 5 days in a hallway, before she was able to see somebody. And by the time she saw somebody, it was a quick in and a quick out. Nothing serious was done to help this woman. And I can read a little bit of this article, but you can see the article by going down to the comment section of this video and clicking on the article. It's right next to the pinned link where you get the Aranda Nation t-shirts. It's right next to there. It's right on the bottom of that link, actually. And it says an Ontario man says he's at his wit's end after his wife spent 5 days in a hospital hallway waiting for a psychiatric care bed. Dawn Warren, who suffers from chronic depression, was taken to Victoria Hospital in London, Ontario by ambulance last Thursday. And keep in mind that the government does not fund ambulance care. Like, if you are transported from one place to the hospital by ambulance, and really you have no choice in that matter, that's not covered. In Canada, or in Ontario at least, the place that's supposed to have the greatest healthcare in the world. And of course, our health minister says that reforming mental health healthcare is the government's top priority. Well, the only reason why it's a top priority right now, and this is a message for the chumps of Ontario. There are two types of people in Ontario. There are the smart people, and there are the chumps, those who will immediately forget everything that this government has done. This Kathleen Cowperthwaite Jezebel wins government has done that has angered them. The cuts in healthcare, the cuts in education, the cuts to autistic people, the cuts to all those services. They'll forget about that just because Jezebel comes out a few weeks before the election, a few months before the election, and comes out with all these new free goodies, like she did back in 2014. Back in 2014, when the last Ontario election was taking place, Jezebel brought out all these goodies. Free this, free that, free everything. She was going to be different than Dalton McGuinty. She was going to be the caring premier. And the Ontario chumps bought into that. And after the election, she cut services to autistic people. Ontario has the most expensive standard of... Ontario is an extremely expensive province to live in. People are being laid off. People are having their hours cut. People are getting their jobs taken away, and they're going to the United States and other places. Donald Trump is having a field day with our jobs thanks to Kathleen Jezebel win and the long-haired Swiftfoot Mac Daddy up in Ottawa, and of course Rachel Notley in the socialist hellfire formerly known as Alberta. But our mental health crisis is another issue that Jezebel cut. I mean, we have people who are waiting in hallways, and Doug Ford has said the word hallway healthcare. People waiting in hallways. We have people waiting in psych emergency wards for hours and hours, and those places are not fun places. I've heard stories of people, in trance-like states thinking that they were in jail. I mean, these places are filthy. These places are dirty. They're dangerous. Many of the employees who work in those facilities really, they're you can't really blame them. They're at their wits' end that they don't even bother to care for the people who are in them. They just stand behind some bulletproof glass window in some office, and y'all are just expected to wait out there like a bunch of zoo animals, waiting for the doctor to come see you, and that can take days and weeks. I mean, people are just sitting there, just rotting away. And that's because of cuts to healthcare. And that's what's happening. This liberal government is now coming out and saying, we're not going to do, we want to put all this money in the hospitals. We want to put all this money everywhere. But, I mean, they did this the last time in 2014. They did this the last time. And look what we got. We got cuts, cuts, cuts. And now they're saying this election is between care and cuts. It is between care and cuts. Doug Ford is the caring populist politician who gives out his personal phone number just like his brother did. I mean, blacks love the Fords, minorities love the Fords, and poor people love the Fords. Everybody who are disenfranchised in Toronto love the Ford name, and soon it's going to be province-wide. Meanwhile, Kathleen Wynne, who has a 6% approval rating, who has done nothing but cut on autistics, cut everywhere, is saying she's the caring one? BS! The only reason she seems caring now is because the election is only a few weeks away. And she's trying to rally the chumps of Ontario. Well, this has to stop. Doug Ford has talked about hallway healthcare. Doug Ford has talked about reforms to our healthcare. We need to stop pretending like we have the best healthcare system in the world, and we may have better healthcare than in America, and we sure do. But we can't just leave it at that. We have become so complacent in Ontario, in Canada, with our healthcare system. We don't dare touch healthcare because we have it so good. Let's just leave it alone. We can't make any reforms. We can't even mention, otherwise you're attacking the Canadian healthcare system. If you even mention it, you're attacking the healthcare system. That's what the politicians have done. They did it, the Liberals did it back in the 90s when they blew up a bunch of hospitals. They blew them up. They closed down a bunch of hospitals. Paul Martin, when he was finance minister, made heavy cuts to healthcare. And the reformers who wanted to reform the healthcare system to make it more cost effective without doing heavy cuts were accused of destroying the Canadian healthcare, the great Canadian healthcare system. Well, try talking to Don about how great the Canadian healthcare system is. Try talking to the millions of mental health patients in Ontario and in Canada who are waiting for days just for a simple doctor. They can't even afford their medication. I mean, mental health people, many of them can't afford their medication, and they just have to end up going to the hospital waiting for days and days and days for a doctor. Try talking to them about how great the healthcare system is. And while we're at it, I think we need to stop resorting to pills and especially painkillers as the first resort. We need to have medication and painkillers and all those pills that these doctors just love shoving down our throats. They need to be a last resort. I mean, we need to think of other ways to help people with mental health and pain and all that other stuff. I mean, Big Pharma, and I despise Big Pharma, because they're the reasons why doctors immediately resort to throwing a pill down someone's windpipe as a first resort to helping someone. And many of those pills have terrible side effects. People get affected by those side effects. They go into the doctor's office, and what happens? They get prescribed another medication to help combat those side effects. I'm diabetic, so I know exactly what I'm talking about. You say, oh, you got the side effect from this medicine? Oh, well, here's another medicine. Let's make Big Pharma even richer. They're not interested in helping us. There are studies after studies after studies, if you go underground, saying that really many people have found a cure for cancer. Now, I don't know if it's true or not, because obviously the government, with Big Pharma's money have restricted a lot of that information. There are studies after studies saying that, there are certain things that we can at least treat it better. We can treat AIDS. We can treat all those things. I mean, even if it's not an all-down cure, we can treat it. But because of Big Pharma and their money, and they're telling the government who are in their back pockets, you better not allow that information to go out. And then they also have the doctors on a string. We don't know. So as a result, people are just turning into pill poppers. We need to stop. We need a politician who can't be bought, who can't be paid for, somebody with enough. I mean, we need to have somebody who's not paid off by Big Pharma and all these people who are just turning us into pill poppers, who will actually have the balls to say, you know what, we're going to do heavy research to figure out if there are actually ways that we can cure things like mental health, we can cure things like cancer, we can cure things like diabetes and all that stuff, without having to resort to medication. The medication is a temporary fix. They have heavy side effects, and then we go into the doctor's office, we put in more pills, and to combat the side effects. And then look at the painkillers. We have a huge opioid crisis all over the world right now. People are dying because of opioids. People are addicted to opioids. People are addicted to painkillers because the doctors, and I've talked to my dad about this, and he knows exactly what I'm talking about because he's a doctor. He knows what's going on. He knows, he sees it every day. These doctors will write prescriptions, painkiller. Here you go. I mean, that's what they do. Oh, I'm in pain. And then what happens is that they get addicted to it. And a lot of these people are poor, and then they go to the doctor's office, they want to ask for more painkillers, and you got a doctor with common sense saying, you don't need this, and then they try to fight the doctor and send him to court. So we need to stop this society of pill poppers. We need to have research and development to figure out how we can solve these issues. And I know it can be done. We're the human race. I mean, come on. If we can put people on the friggin' moon, and many people say we didn't even do that, but if we can do that, hypothetically, we can figure out these issues. And many people have said we've already figured them out. So let's do it. Stop electing these politicians who are in the back pocket of Big Pharma. Can you imagine what would happen if we figured out how to cure things like if we could look into the brain and see what's going on? I mean, look, we could even do stem cells and stuff like that. I mean, I'm a Christian all day long, but you know what? When it comes to helping fellow mankind, I believe that God created us to help ourselves doing this. We can't just sit around and say, oh, let God deal with that. We have to he gave us he already figured it out for us. He gave us a brain. So let's think about these issues and let's get it done. For the betterment of mankind, we can stop the mental health crisis right there. Save billions of dollars for our governments. But the only way we can do that is if we stop electing politicians who are in the pocket of Big Pharma. This is the Arana Nation. Make sure to get your Arana Nation t-shirt by going down to the comment section of this video and hitting the pinned link that is at the top of the comment section. Right up top, the link where I show the mental health crisis that's going on in Ontario. Click on the pinned link and you will be at the website where you can get your very first Arana Nation t-shirt.